end so that you all have this to help make your classrooms and a little bit easier for you guys to get everything together from this webinar. So we'll send that out to you after. Again, reminder to put your questions in the chat. And then I am going to introduce our two lovely panelists who will be telling you guys a little bit about how to put the extra in externships today. So our first guest is Laura Flynn. She is our NHA CTE Director. We are super excited to have her on the phone right now. She has lots of experience in the education space. And we also have Stacy Foster with us today from Metro Nashville Public Schools. And she oversees the health science programs within Metro Nashville. So we are really excited for the two of them to be here with us today, and we are going to go ahead and get started.
We had just 1 minute of technical difficulties as we hit the 10:30 mark. So Stacy Foster, can you just let me know that you can still hear us and check that we can hear you?
Yes, ma'am, I am here. Can you hear me okay?
Perfect. So glad to hear your voice. Before we jump into the content of our webinar, we did just want to take a minute and reflect on the week you all are having in Nashville. We know that 2 destructive tornadoes touched down in your area, and we just thought we'd ask for you to give us an update on how that impacted your district and the people around you.
Absolutely. So I'm sure most of you all have seen the news. It's definitely made national news at this point. We did have a tornado in our area that did affect some of our families and our communities. If you've been to Nashville, it was on the east side of Nashville and then traveled east out of Davidson County and 50 miles then, across the state of Tennessee to the east. And so it impacted us here in Davidson County and Metro Nashville, as well as several other counties and other school systems as well. Here in our area, we are fortunate that related to our schools, we didn't have any fatalities, no issues with our families other than just some families obviously are inconvenienced with some damages, slight damage to their homes, and then as well as power is still out here. Many of our schools don't have power. Our students are out until next week. But we are very fortunate and very happy that it wasn't as severe as it could have been. Many of our district employees are out today, as well as yesterday, volunteering in our community. And Laura so kindly put the 2 links here on the screen. If you're interested in providing support to us here in Nashville, the Community Foundation are the folks who are leading the way in the disaster recovery here locally, along with the Red Cross, of course, who are coordinating aid. So we are very fortunate and very happy that, again, the majority of our families are safe and sound, and that we are, of course, always in the process of rebuilding.
Yeah, absolutely. We get it. That recovery effort is often on the news right after it happens and then disappears as the real work begins. So we just wanted to create some awareness and just a reminder around blood donation. It's important all year, regardless of what's happening with natural disasters. It's such a easy thing for those of us that can donate to do and really contribute all around, year round. So thank you for the update. We're really thinking about you all, and as you know, we're all willing to help as needed, so keep us posted.
Will do.
So we're going to dive into the content today. We're going to talk about externships. One of the reasons we decided to really have this conversation is that we really hear from our programs on a regular basis that there are just so many barriers for high school students to gain access to work-based learning. Whether it's the myth around students have to be 18 or they don't have transportation, or just a perception from employers that high school students aren't capable, or that they don't even know that there are high school programs in their market that they could be tapping into. So we wanted to put this content together today because we do know that when employers decide to break down those barriers and open up opportunities to learners, that they really benefit from reducing their training costs and their recruitment costs. They end up hiring better, more prepared employees who have a better understanding of the workplace, and they're ultimately creating a talent pool that becomes their future leadership. So we know that there's value for both the school systems, the students, and the employers, and we just really want to create awareness around that today. So back in December, Stacy Foster and myself and several industry leaders in the education space really spent a couple of hours talking through what the challenges are for CTE programs to get access into the employer space. And through that conversation, we have created a list of things that we think are extremely important. So many ideas that I think we got the majority of them in here to really help create best practices. And that's how we're going to help you all put the extra into externships. So we're going to start with engaging the employers and how to go about doing that. Talking about the X factor, which is your students. Getting into the training piece and really helping an employer carve out training that aligns to both your program needs and their workforce needs. And then we're going to share with you several resources that can help you get moving in that direction. And then last but not least, we're going to give you an action plan that you can start to manage on how to create more opportunities for your students. So the very first step is to engage. To really create engagement with your employers, you really have to do several key things. You have to utilize your networks, create an advisory board, build awareness and sustain relationships, and then ultimately take action. So today we're going to talk about those pieces. Utilizing networks. So this is really about reminding each of you educators that you are ultimately the most important piece to building out these opportunities for your students. Partly because as a person who has healthcare experience in their background, you are already tapped into a network of people that you can lean on. It might be current or former employers. We know some of you might have weekend gigs, side hustles, so to speak, with current employers that are adding access, that could add access for your students. And then colleagues and peers. So perhaps you have a former coworker who's now climbed into administration at one of your employers, so reaching out and connecting with them. And then connecting with your other educators to make sure you understand what they're doing to create success and where they may have found opportunities. But don't worry, we're not asking you to become a car salesman. We're really just asking you to start to be the advocate for your students, to create awareness where maybe you didn't before, and really sharing the most important things about your programs to help knock down those doors. And then there's some areas. Oh, go ahead, Stacy.
Yeah, no, I'm sorry. Go ahead.
Oh, I was just going to say there's also some areas you really want to start to develop more contacts, and that is your Chamber of Commerce, your workforce organizations, nonprofit groups, and then really starting to identify where the jobs are. So if you have an employer who has a large amount of job postings for medical assistants, you know they're in crisis mode and they might be more willing to be innovative and think outside the existing box to create access to your students. Stacy, you have some really unique opportunities around workforce organizations and advocacy groups. You want to share some of that?
Yeah, definitely. And I was actually going to jump in and say that all of these people on the screen, so your current employers, your former employers, the workforce organizations, all of these folks have the potential to be an advocate for your program, but sometimes they just don't know. And so you do have to kind of take that and tell them and ask them very specific needs. And sometimes it's also an ask of who do they know? So they may just be able to act as a connector for you, even if they're not in a position to help. As Laura just mentioned, here in Metro Nashville Public Schools, we are very fortunate to kind of be in the healthcare center of the universe, if you will, with lots of healthcare organizations right here in our city. And we started it really by reaching out to our Chamber of Commerce initially, who really helped forge some of those connections for us on our behalf, but then also working directly with those organizations, those companies, to identify very specific needs that we had. And then from there, we were able to, again, kind of expand out to other organizations and other people. And so it really did begin to kind of spread, if you will, like a web of people. But it really did take us defining what it is that we needed, where we needed, and making sure that we were communicating that to people.
Perfect. And then one thing I thought was really interesting is to really make sure we're not forgetting our school administrators. The superintendent or the higher level C-suite within a school district can really seem like they're focused on things outside of the classroom, but ultimately they are out in the community on a regular basis, networking with other industry leaders and organizational leaders, and they can often, through a high-level conversation, start to open the door and create awareness around the programs that are happening at the CTE level. So just please make sure to not forget to communicate and ask for help from your administrators. They really might already have contacts and people who are asking them, how can we help? And they didn't have an answer until maybe they learned more about your program. So don't be shy in reaching out to them as well. I'm going to now turn it over to Stacy and allow her to really share an overview of how they look at their advisory boards and their business engagement, and then we'll talk more specifically about steps for advisory boards.
Yeah, so I am excited to talk first about our model for business engagement here in Metro Nashville. And I want to preface this by saying that we employ what's called the academies model. And so you'll see me reference throughout this presentation academies. You'll hear me say that word. And so really what I'm talking about are small learning communities within a comprehensive high school. And we base our academies on career pathways. So it's very CTE focused. And so that is the basis for the entirety of how we do high school here in Metro Nashville. Just because that's the way we do it, though, doesn't mean that you can't take these very same ideas and use them in your district, even if you're not doing the academies model. So again, just wanted to start with that statement. So here in Metro, we kind of have this three-tiered approach to business engagement. And this graphic does a wonderful job of kind of describing the funneling up and funneling down of communication and engagement. And so I want to start by actually talking at the bottom level here, where we have individual academies, so school level advisory boards. And so these look probably very similar to what most comprehensive high schools do, as far as you have a CTE advisory board, or maybe you have a health science advisory board, or however you all structure that in your district. And that advisory board comes together, maybe once a semester or something like that, and just talks about what's going on in the classroom. They talk about learning opportunities and that kind of thing. And so these boards are very school focused. And so in our district, we have 12 zoned high schools that have academies, and you may have multiple advisory boards at each school, and that's totally fine, and they're all focused on their particular pathway. So we would have a health science one, for instance, at most of our schools. And they're working with those teachers, they're working with those particular students. And so that's what's going on at the kind of the base level, so the boots on the ground, if you will. What happens from there is that the leaders of those advisory boards come together in a quarterly meeting at the district level. And at the district level, we have what we call partnership councils. And what that does then is enable representatives from each of our 12 high schools to come together and look across the academy lines to look at how we're using resources. What is one school doing that maybe another school doesn't know about, or what's happening in a STEM pathway that maybe a health science pathway could borrow from. And it also gives us a chance to look at labor data and ensure that all of the workforce needs that are happening in our community are being met. We also bring our post-secondary partners to the table at this meeting as well, so that we can talk about what their needs are, and also aligning what we're doing in our classroom with what's happening at the post-secondary level. So these are much higher level conversations where we don't really do a ton of maybe strategic planning so much as just discussion. So it's just an opportunity to share and communicate what's going on across the entire district. From there, we have a select group of folks who then report up even one level higher that are really focused on the community and going out and communicating our needs and our successes into the greater Nashville area. We found that a lot of times people just simply don't know, and that's what I was stressing even on the slide before. They don't know what's going on in our schools. They don't know what's going on in your school. Even in a small community, a lot of the time, you may be surprised if you talk to someone who's not affiliated with the school how little they actually know about what's happening. So these CEO champions, our community team, they do a wonderful job of communicating our successes, communicating our needs and our challenges, and making those asks. So they're the people who will go and make these big grand things and say, we need a hospital partner to come on board with us. Who's going to step up and do this? So that's what they do. And then, of course, it funnels in the other direction, too. So things that are happening on the community level come down to the district level and we talk about it, which then of course gets pushed on down to the school level so those things can be implemented. So that's kind of the model for how we do business engagement in our district, which of course informs how we do all of our experiential learning and all of our externships and everything else that we're going to talk about in this presentation today.
Perfect, thank you. And so I think the interesting thing is you're right, like if not every district has this full scope. So it's really about starting where they are, and that might be at the school level, and then building from there, or vice versa, right? There's no wrong way to go about doing it. So I'm going to take us to the next slide around advisory board creation.
Yeah, so we obviously had to be very intentional about creating advisory boards. And this guide that we put together and have revised over the years does a wonderful job of helping us think through kind of the why and the who and the how. And so we always, of course, want to suggest if you have not got an advisory board in place, think about creating one and think about what the purpose is of that advisory board, because it does serve a dual purpose. You obviously want to form this link between the business community and the school community. And that's a critical link, and it's a critical opportunity to be able to discuss what's happening in your classrooms. So what's going on with your curriculum, what type of instructional strategies are you using, are you doing industry certifications, what type of experiential learning opportunities do your students have or need, and then also what's happening in the workplace. And it gives you as the teacher some insight into what's going on in that business community. It's also a good opportunity, too, to talk about some of the barriers and issues and things that come up. And so I'll just share that here in Nashville, one of our issues that our advisory boards talk a lot about is transportation. We don't have a good infrastructure for students to get around. Many of our students don't drive. And so sometimes these advisory boards do spend and invest a lot of time into thinking through strategies to help overcome that obstacle. And it's a wonderful opportunity to do that. And so that's our why. And sometimes our advisory boards do have different whys. It just depends on the school and the setting and the pathway. So feel free to, again, allow your advisory board to kind of shape that, but you do want to come in knowing that there is this mutually beneficial purpose because you want it to be useful on both sides. And then once you start thinking about how to form this board, again, you want to think about who should be a part of the board. And so we, of course, always want to suggest that our teachers who are in that, and we do academy, so our teachers who are in that academy or that pathway be a part of the conversation. We do include students in that conversation as well. We, of course, include our major kind of business and community partners who are affiliated with that particular pathway. In a community such as ours, so a big district, we do have to be careful about not overburdening one particular, say, hospital, because they'll be asked to be on 10 different advisory boards. And so we don't want it to do that. And so we do have to be strategic. And so even in a small community, if you have one major employer, you may need to think critically about whose advisory board is this one employer going to be on each year. And so identify those members and make those asks. We also were very intentional in this guide about setting forth some expectations. And so you want to, again, be clear with anybody who's going to participate on your board how engaged they're going to need to be. So what types of things you're going to want them to do. Are they going to be expected to go out and advocate in the community? Are they going to be expected to communicate about your program with others? Are they expected to be physically there? Can they call in? So there's all these things that you're going to want to think about that you're going to need to clarify, because those are the questions that they're going to ask you almost immediately. And then, of course, the cadence of the meeting. So think about the frequency that you're going to do it, but also then the agenda. So how do you keep the pace of the meeting going, but then also how do you make sure that the meetings is meaningful? And so in this guide that we put together, we do have sample agendas, and we do have, we did think through even topics and things that, yes, thank you, Laura, that goes through how do you monitor your work as an advisory board? So how do you start to self-reflect? And so some of the areas where we ask our advisory boards to do some self-reflection every single year is around how engaged they are. So are people actually coming? So do they come? And then also how meaningful is it? So are there any actual tangible outcomes that seem to benefit either side of this advisory board? We also have them reflect on the communication piece. So what happens when maybe a key player on your advisory board just simply can't be there one time? And so how do you communicate what happened at the board with other people? We also had the teachers chime in around the professional development piece of, did they feel like they were receiving any type of mentoring or aid from the partners partners who were there at the board, because that was one of the things that was really important to us, was to start to develop almost mentorship relationships between our employers and our teachers. So the teacher would have someone to go to for advice or suggestions and that kind of thing. And so we wanted to be sure that was happening. And then we also, of course, had them reflect too on the calendaring of these events. So the advisory board meetings, do they actually happen? Do they show up on the calendar, and then do they happen, or do they constantly get bumped for other things? So this is all, again, in this advisory board guide that we put together, and I think are going to have a thing for you to take a look at. And then it also, again, has some sample agendas as well in there, as well as just general meeting guidelines. So things like establishing norms, making sure that, again, people aren't, getting heated in discussions, because they will, or, being distracting by being on their laptops or phones, because that happens too. And so all of that is there, and things that, again, have been really helpful to us that we're more than happy to share with you and your communities as you're starting to get this going.
Yes, you bring us to a good point. Stacy Foster and Metro Nashville Schools has been very forthcoming, and they are going, this as part of our follow-up, we will send links to all of these documents so that you can download them, see them as an example of what you might want to use in your advisory boards and not have to reinvent the wheel. So we will share that as part of our follow-up, as well as the other resources we talk about today. So everything will be available to everybody, including the full slide deck and the tools that we mentioned here today. So that's fantastic. Thank you so much, Stacy. I think that you're right. It's really about creating a long-term sustainable relationship. And there's lots of ways to do that. So once you get them involved and get them to your advisory board, how you continue to nurture that relationship and make sure it is working for both of you. I'm going to let you dive in on this, but I did want to share that I think one thing is really that piece of gratitude comes through in more ways than we realize, because when they are contributing that time to us, they really are volunteering and doing it outside their scope of expectation of their existing role. So I'm going to have you share how you do that, how you your district does that to support your partners and show how much you appreciate them.
Absolutely. So one of the things that we do, and you can see this little example of something that was posted on our Facebook page, is we do what's called Powered by Partners. And we do spotlights on all of our partners across all of our academies. And so, of course, I pulled an example here of one of our healthcare partners. But in these Powered by Partners series, we actually put together YouTube videos that highlight some of the pictures and some of the student talking and that type of thing from field trips and other sorts of guest speaking. So we're pretty intentional about gathering that photographic type thing, and then also videos as folks come in and work with our students, so that we can put together these examples of gratitude. And our employers and our partners are so ecstatic when things like this post, because it gives them a tangible something to go in their office and show other people. Another thing that we do, again, is highlight other folks as much as we can through news outlets and newsletters. We hear a lot of times from our partners that having something even in our district newsletter about one of our partnerships is something that they can print out and post on a board in a community room at work or by the photocopier or wherever it is. Again, just kind of showing that tangible proof of this partnership. We also do partner recognition type events at the end of every school year, and we invite them, and we do a kind of a big celebration one afternoon. But we're very intentional about showing gratitude and being grateful for the efforts that they're putting forth and investing in our students. And we do that, again, a lot through social media, but we also do a lot of in-person gratitude as well.
That's fantastic. And I love the idea of the newsletters, because ultimately we want to promote our partnerships and the opportunities they're creating for us, but we also want to create awareness within our population that the parents, the students, the counselors know that the programs exist and start to raise their hand to say, how do I become part of that, right? So how does my student or myself get involved? And so it's kind of a 1-2 punch to keep the information flowing both directions. I love that.
It is, and what's interesting too over time is that and I'll continue with our health science example. We started out a couple of years ago with one primary healthcare partner here in Nashville, and that was a wonderful relationship that we nurtured and built and grew, and it continues to thrive. We highlighted it so much in news outlets, on social media and everything, that the other roughly 5 or 6 healthcare corporations and organizations here in the community all reached out to us over the following years to say, I want to be that too. How can I be that too? And so it increased the awareness in our community even of how a business could be partnered and engaged with the school. So it kind of had that benefit too, and we were really excited about that.
That's fantastic. That's the dream right there, that they're coming to you, right?
Right.
So just some action items for everyone on the phone. So first and foremost, like we said, this is big picture. This is a district who has developed a really experienced, well-grounded formula for how they interact with employers. So if you're just getting started or evolving your program, how do you get started? So first and foremost, you're going to create a target list of your employers that you want to get involved. Who are the people that you want to engage with? And I encourage you to think outside the box. Your big top name employers aren't the only people in town. So thinking about those small businesses, the individually owned pharmacies, or the standalone doctor's offices, sometimes they have more flexibility in their policies than a large corporate organization. So kind of weighing your list to include both types of entities. And then you're going to begin the conversation. So really starting with the 3 things you want an employer to know about your program, why your students, right? So those top 3 things are the things you want to have in your hip pocket when someone says, tell me about what you do. And then asking questions, having 3 quality questions that you always want to learn about an employer that might help you get traction with their needs. It might be as specific as, what do your frontline roles look like? Or do you have access for students? And then really starting to listen to what they tell you. That's the key thing. As you start to have those conversations, we can get wrapped up in our needs, but really making sure we're listening to what they're telling us so that we can act according to their goals and not just our own. And then getting them involved. So making a plan to have that next step. Is it having them come visit your program and see what we're going to talk about, which is the X factor, your students? Is it having you tour their space, or having your students tour their organization? Or is it as small as just having coffee and continuing the conversation? So really working out that plan, and that's part of the action plan that we're going to have as a combination, as a follow-up to this meeting. Did you have anything to add to that, Stacey?
No, I think you've got it.
All right. Well, now we're going to jump into the fun part, the X factor, which is our students. And I say that because not a day goes by where I don't hear a story about some phenomenal CTE high school student changing the world. And every time we go to a HOSA competition and meet these students who are so passionate and excited about learning and developing a career in healthcare, I don't know what employer wouldn't want that type of individual in their workspace. It's infectious and it's exciting, and it can really change the game. And so I think there are a lot of perceptions with employers around what a stereotypical high school student looks like, right? They think about someone who's looking at their phone, and they think about someone who's disengaged and doesn't want to talk to people. But those aren't the students that we're talking about today. These are the students that want more and really want to develop that. And we can, as educators, really start to highlight those individuals. So I'm going to turn it back over to Stacey and let her talk about what you all have done and how you have worked through aligning your programs to what the educators, or to how you as an educator align to the healthcare providers' needs to help them understand how to create access for students.
Yeah, so it is a task. Let me just start by saying that. It is very difficult, especially when you're first starting, to align programs between what you're trying to do in your classroom and what's happening in the healthcare world at the moment and what their needs are. And often they're not aligned, right? You as an educator have this commitment and this need to teach standards, right? You're teaching rigorous coursework. You're wanting to ensure that students have those workplace experiences, but you also have these competing demands of ensuring that your students are earning industry certifications, right? You've got to be in your classroom teaching that content. If you're doing dual credit or dual enrollment, then that is a lot of additional coursework in a lot of cases on top of those rigorous standards that you're trying to do as well. And then you're also doing skill attainment. And so you want to make sure your students have opportunities to practice those skills. And you as an educator also know and understand the developmental level of your student, right? You understand that you're dealing with 14, 15-year-olds all the way up to 17, 18-year-olds. You know where they're at developmentally, you know kind of what their background knowledge is and also kind of what skill sets they have. Your healthcare partners in your community do not have that context. One, they do not understand a lot of times what you're doing in your classroom and what your constraints are as far as needing to teach standards, needing to teach certain coursework, even needing to be able to utilize an industry certification that your state or your district has approved, right? And then they also don't understand a lot of times too, what your students are actually capable of, and not capable of long term, but capable of right now in the moment as a 16-year-old, what it will be like to have them actually in the workplace. And so one of the things that we have done through these our advisory board meetings was to really intentionally talk about this program alignment piece. We ensured that our partners who attend these meetings understand the curriculum that we're using. A lot of times they do weigh in on it, especially if there is a choice, of using this particular curriculum or this particular textbook. We bring those materials and engage our partners in that conversation. When we look at our industry certifications, our partners and these healthcare providers in our community have a very strong voice about which ones we are offering. And sometimes their voice is very, very, very strong. We wish it was a little less strong, but they are heavily invested in making sure that what we're doing in our classroom is actually going to meet those job demands that are actually students are going to encounter when they get to the workplace. So they really advocate for particular credentials or particular coursework or even certain dual credit or dual enrollment courses that will help a student in the long run. So for us, I guess the big takeaway there that I want you to hear is that it began with just a dialogue. So sharing that and acknowledging the fact that sometimes there is this misunderstanding of what's going on. I was a classroom teacher for a very long time, and I had partners who would come to me and say, well, why don't you just teach this other thing? Because this is what we want. And I had to explain, like, well, I'm actually constrained by these particular things. And for a lot of times, it was very eye-opening for them. They were just simply unaware of kind of how school works. So have those conversations. I think that the second piece also, again, as a conversation piece, and you can do this through your advisory boards, is being sure that you're communicating to your partners how they can help. And if there are misalignments in the program, so let's just say in your courses that you're teaching, it's really focused on, these particular, say these 3 skills over here, but your employers actually want these other 2 skills that are outside the scope of your class, and maybe even outside the scope of your particular industry experience, because that happens too. So how can they help? Can they train you? Can they come in and train your students? Can they take your students out to a simulation center and do that particular instruction? So can they enhance what you're doing in your class somehow? And then also, can they help with the professionalism and soft skills? Because again, there is a huge mismatch. I'm sure any of you who have taken students on field trips know exactly what I'm talking about when it comes to professionalism and soft skills with students in workplaces. And so that takes some training on your side, right, to ensure that your students, and we're going to dive into this a little bit more pretty shortly, but it also makes sure that your employers understand kind of where your students are at also. So one of the things even for us, and I'll just give this funny example, was one of our healthcare partner that we started with initially, we did some behind the scenes tours of one of their hospitals a couple of years ago, and they really wanted students to dress professionally. And so that was what the instruction from the hospital said. So we allowed one of the hospital staff to kind of come up with this letter that went home with students that kind of explained what the day was going to be like. And it said, dress professionally. To many of our students, they had no idea what that meant. And they showed up in a variety of dress, everything from, like church clothes, like full-on suits, to some students did kind of understand, oh, that means dress like you're going to an office. But even that is so loose, right? Sometimes, I'm wearing jeans today at the office, so does that mean dress professionally? So we realized there are even just things like that where you really do need to be explicit about what it is and where students are at, because they just don't simply have the context for what that means, because they just haven't had the experience.
Absolutely. That piece is something we hear all the time. And I love what you all did to create some standards across your programs around handbooks and guides for both the employers and the schools.
Oh, absolutely. And so for our educators and really for everybody, we put together this job shadow manual, and this was just one example. We do some tiers of what we call experiential learning, and again, we're going to come to that, but this was just one of them, job shadows. And we realized that we wanted students across all of our different schools to have a consistent experience, whether this is a healthcare job shadow or whether it's one going out into a manufacturing plant, or maybe going even to the football stadium and shadowing someone who works there. So for our educators, we have this kind of set of checklists and activities and things that help the educator define what is it that you're hoping to accomplish with this job shadow, and then how do you actually inform your parents and your students about this opportunity and ensure that they understand what the intention is, what students are going to do when they're there. So it's not the nitty-gritty so much of like, how do you ask for a field trip? How do you get a sub? How do you, get a bus? It isn't that. It is more of the, why are you even doing this? What benefit to your students would a job shadow be? What is it that you're hoping that they're going to come back to the classroom and do? How are you going to debrief this experience with them? And so we thought through those questions on the educator side, and we put together this handbook that also has some student expectations in it, as well as some employer guidance that helps the employer, again, understand some of these nuances of what it's going to be like to have a high school student in their setting, as well as kind of some of the insurance questions and other things that go into having students out in the workplace. And so as we continue again to kind of talk, because I know a lot of you are educators, I want to talk a little bit more also about preparing students and especially preparing students to be in a healthcare setting. And so these are some things that we dealt with. And so I just want to touch on them a little bit. And again, preface this also by saying that this may vary in your community. It may vary depending on the partner that you're working with. It may vary depending on what their rules and expectations and also the age of your students is. So one of the things that we found was that for a student to visit a hospital, so just a one-day visit, they didn't need vaccinations or background checks or that kind of thing. But we found that if they were going to do a job shadow or an internship or anything that was a more extended experiential learning opportunity, they did need those. And for some of our students, we have a very broad set of demographics and backgrounds of our students. And I mean, we have schools that have more than 40 languages spoken at them. Sometimes vaccinations were not just a medical decision, but they were an ethical or a moral or a cultural decision. And so how do you grapple with that, right? When you have a student who just simply, or their parents just simply will not permit them to get those vaccinations in order to do this experience. And so we had to be creative and find ways to provide an alternate experience for that student that didn't conflict with what their actual needs were. We also realized that some of our partners did require background checks. And so background checks, not just of some of the students if they were over 18, but also background checks of our teachers. And of course, we know as teachers that, well, we already have them because we're employed by a school district. And then, of course, it goes the other way, too. So in order for some of our partners to come into our classrooms, they also had to undergo a background check. And so we realized early on we needed to be very clear and intentional about that because it's often at the employer's expense, and at least it is in my district. district may be different in yours. So clarify that. Who's going to pay for background checks if it is expected on either side? I saw a question pop up earlier about HIPAA, and we'll get into that later on in the Q&A also, but it is mentioned here, and so I want to make sure that I'm very clear also about preparing students for privacy issues. And I'll share an example of a challenge that we encounter here in our district. So one of our high schools actually has a health clinic inside of it. So an actual functioning health clinic that's open to the community. It is a completely free health clinic that is provided. Actually, the partner whose picture here is on the page, St. Thomas and Ascension, they opened up a health clinic that's a community-based clinic, and our students have the opportunity to do job shadows and internships at that clinic, serving the people in their own communities. Which sounds amazing, right? But it does bring up privacy issues, because what happens when you are treating someone who you know, or you're treating someone's mother or grandmother or sister or brother, whoever it is, and you know them, and you can't then go back to class and talk about that. So we really do a lot of HIPAA training, and of course we do OSHA training. We just recently have implemented OSHA training across the board in our health science academies. And so being very careful about those guidelines and those laws to ensure that our students are in compliance. We also, of course, want to make sure that our students, oh, I'm sorry, Laura, did you have something to chime in there?
No, finish up what you were saying. I didn't mean to interrupt.
Okay, no worries. And then we also, of course, want to make sure, depending on what students are going to be doing, that they are experienced and have some counseling around trauma and what they might experience when they're out in the field. We also had to address transportation, and I kind of alluded to that earlier, that was one of the biggest challenges in our district is transportation. We don't have a lot of students who drive, and you may not either. For us, everything is very compact, so it's a kind of a tight city, if you will. A lot of our schools are close by, but it's far enough that they can't just walk from one place to another or walk from school to a business and that kind of thing. So we had to get creative, and so sometimes what that meant was transporting students using the hospitals, like buses, if you will, how they kind of will sometimes have a shuttle or that kind of thing, or even calling on some of our partners in our other academies. So we have a lot of academies for hospitality, and so again, we're Music City, so of course we have these big hospitality programs. A lot of times those partners have private buses and transportation that they're willing to donate, and so that was actually, when I joined Metro, that was one of the most eye-opening things for me, was to think about how partners outside of the healthcare field could actually support programs and things that were going on in the healthcare field. So we do draw upon our partners in those hospitality areas to help us with transportation, and it's a really good creative solution to that. We also, of course, had to talk about attire with our students, and that, again, I mentioned that a minute ago, we needed to define what business meant, and actually over the years we have dropped that entirely. We don't do business attire when we go on field trips anymore. What we do is scrubs, and our partners, for the most part, donate scrubs, and so you can see our students who are there with the partner. So the partner in the middle, and then those are two students on either side of him, they purchase scrubs based on the colors of their particular organization. So you might see black ones, or you might see orange ones, or whatever color it is that the business partner has picked. And that's what students wear.
I love that, because I could hardly tell which one was the person who's the employer.
I know, right?
They are showing their professional faces in this picture.
I know, it's awesome.
We hear it all the time, Stacey, the challenge around the soft skills piece, which is one of the reasons NHA has developed a new tool that's launching in March called Personability. It's a new tool that's a comprehensive learning and assessment of essential skills, and it can help teachers bridge the gap in the classroom to really make sure they're building their essential soft skills and that they're driving behavior changes through a process that utilizes learning and assessment in virtual learning. So we're really excited about this. It launches in March, and it can really help close that gap, and it can be layered into the program wherever they need a fit to help prepare those students to be ready for either their externships or their employability. So we're really excited about that, because we can help your teachers in the classroom prepare their students for those job experiences.
Yeah, that's pretty awesome.
I think we're going to do a quick poll from the audience. We want to get you all involved out there, make sure you're staying engaged. We know that webinars can be a challenge. So you should have on your screen an opportunity to answer questions about personability, but this tool is going to have, it's a specific tool for healthcare employees, specifically for medical assistants, nursing assistants, LPNs, patient care techs, and phlebotomy techs, to really help them strengthen their professionalism, strengthen their communication skills and how they interact with patients and doctors. And we're very excited to get this out there in the field. And if anybody is also interested, please connect with your certification specialist, because we're also looking for opportunities to have people pilot this. We're going to give it just another minute. All right, thank you so much for your answers. We will be following up on that. Our next content area is specifically for our employers and how we can help the employers break down those barriers. But I do have to show this amazing image, because through the steps that Stacy and her team and instructors have taken, they've created a broad width of experiences. And you can see how professional their students look out in the field. They're getting to interact with all different kinds of environments, from hands-on to doing actual patient rooming and that kind of thing. And you all have just created a great program there, so we're really proud of you. Some actions for each of you to take as we move into the next section. You want to make sure to develop a handbook so your students have clear expectations on what their role is and how to behave out in the field. You want to align your standards to your employers and make sure that you're producing students and opportunities for students that align to both of your needs. And then ultimately, we want to prepare students and make sure they are aligning to the professional skills and have the essential skills as they go out into the next phase of their education path. We're going to move into the training space a little bit. I know we're getting a little closer to the end of time, but we want to make sure to really hit on these important steps that employers can take to get involved. We're going to talk about aligning levels, and Stacey, you can add a little bit of color to this, but I think the important takeaway here is that we want to make sure that people understand there's more than one way to get involved. And that a sophomore in high school might have a different experience or needs than someone who's finishing their certification as a senior and needs to have some specific job skills training. Do you want to talk a little bit about guest speakers?
Yeah, absolutely. So we encourage our partners to come in as guest speakers. I'm sure a lot of you all probably do the same thing in your programs as well. It is we kind of think about guest speakers honestly as like a toe in the water, if you will, into experiential learning. A lot of times our partners are willing to send a guest speaker out to speak with our students before they're willing to commit to any of these more deeper engagements. And so I want to encourage you to think about it that way as well, because it does reach the broad group of students, so everybody from freshmen to seniors, but it does give you a chance to kind of have that one-on-one conversation as well with that partner while they're there in your classroom, to try to get them a little bit more engaged and maybe bought into offering some of these other opportunities to your students.
And then that's fantastic. The other thing is really thinking outside the box for the types of locations that students could be learning in, from long-term care facilities and acute care facilities, doctors' clinics through ambulatory care. But one of the areas I think people forget about is labs. So especially if you have a phlebotomy program or students who are wanting to have one-on-one communication or experience with patients, labs are a great opportunity. And then do you want to talk a little bit about simulation training centers?
Absolutely. I will be honest with you, we had no idea such a thing as a simulation training center existed. I didn't even know that was a thing. Maybe some of you with a little bit more health science background automatically know, but I did not. One of our partners, as they heard some of our challenges, particularly around HIPAA and around the vaccinations and around transportation, there were all these factors, right, as well as the employer's capability to host a large group of students. And so just one day out of the blue, she says, why don't you just come to our simulation center? And so we were just floored that such a thing existed. And so it has been a wonderful solution in our community where students can come. They can host a large group of students because in this facility they do a lot of their nursing education type classes and training. And so they can host a lot. We also then can simulate the exact type and kind of topic of training that we want to provide our kids. And so sometimes they'll be very focused on just phlebotomy. Sometimes it's focused on patient care. And so we can really customize and not have to worry at all about any of those other factors around, again, privacy or age or anything. And so it really has been a wonderful solution for us. It doesn't take the place of any of these other locations, but it certainly supplements it.
Nice. That's very exciting. I hope lots of people are jotting that one down. But we also want to make sure we set standards and expectations from the employer space. As we talked about at the beginning, I think one of the biggest challenges is the perception from an employer or employees within an organization that students who are not yet 18 cannot be in their workspace. And so I just want to set some ideas into our employers that might be on the phone. So first, really double checking with your state workforce laws. There's definitely a myth around the level of 18 and the age of 18. And I think that if you start to dive into what those state laws are, you will find it might actually be a corporate policy versus a state or federal mandate, which means policies can be adjusted based on what you are looking to achieve, right? So first and foremost, identifying the workforce laws in your market and making sure that you know what they are and that whether they truly do have some limitations. And then second, oftentimes it's about creating a specific position for these types of students, especially if it's something where they're going to be working in a part-time way, whether they're receiving pay or not. Being able to define that position so that employers can explicitly show what the individual is going to be doing allows them to create policies that support the individual and really create access. Additionally, identifying insurance waivers. So there may be additional corporate paperwork that needs to be on file with organizations who are insuring the employees and the patients and making sure that those are all in place. And then there are funding sources. So Perkins and which is the funding model for the CTE programs, and states both have opportunities that are funding employers to create access for high school CTE students in their space. So you may be able to create pay-based positions that are funded through these models. And information for those can be found on the state CTE webpage, which is through the Department of Education. And you can search that through Perkins and work-based learning experiences. Mm-hmm. Additionally, making sure the students have provisional certification can help an employer show that a student, regardless of their age, is capable of doing the role that they're being brought in to shadow or observe. So that can also help knock down barriers if needed. This is another thing. So making sure that we connect with the employers who are the employees who will be doing the training during the student's experience. So defining the outcome for the trainers, if they understand why they have this student shadowing them, they're going to be much more likely to engage them, that it's going to benefit them by being able to capture a well-qualified individual in their job space, which ultimately gives them less work while they're on the job. So making sure we're engaging the trainers, that we're setting guidelines for the trainers. Often students come in and they don't want to train them, and so they might end up sitting in the corner doing paperwork instead of learning the skills they need to do the role. So making sure we communicate that with the people who are doing the training, the preceptors, and then engaging the team members who maybe aren't people you traditionally thought of as trainers, because they are often doing shadows and maybe not hands-on patient engagement. This is a great way to engage new team members in the process. And then additionally, making sure that as an employer, you're setting up communication back to the school. So I think sometimes we hear from educators that from employers that they're frustrated with the types of learning the student is doing or that they're not progressing, but often it's because the educator's not getting the feedback directly on the student and then isn't able to do coaching back in the classroom. So making sure the communication is going both ways for both before and after the students are in the workspace. Anything I missed on that, Stacey, that you'd like to add?
No, I'll just reiterate that I think, yes, as an employer, please communicate with the educator about what is going on in your workplace with students and your general overall feeling about it, because again, sometimes they don't know if they're not there seeing it, and then vice versa as well. So you as the instructor, reach out to those employers who are hosting your students and encourage those open and honest conversations and seek feedback, because that's the only way that we have found to sustain those relationships over time, and also to give us the feedback that we need to improve the way that we are preparing our students and preparing our classes to go out into the community.
Nice. So I went too far. So to take action from an employer space, it's identifying your policies and if any of them need to be changed, and who in your organization can help you make those changes, setting up communication with your educators, and developing a site monitoring plan with your educators so that you are on the same page. Which brings us to the resources. We have some great resources that everyone in this call will be able to take away. First and foremost, we have our CTE Media Kit. So this is some templates we've developed for the educators out there to help you create awareness of your programs. This is your district newsletter and a press release template. You simply get to add some photos, update the information specific to your program, and get started on creating awareness around your program out there, which we talked about is so important for both sustaining partnerships and creating awareness of your program. Personability, as we mentioned, is coming in March, and that will help you develop and prepare your students for their job ready and job experiences. Oh, one more. Stacy Foster and her team has offered to share their tools that we've shown here, the Academy's Advisory Boards manual, the Job Shadowing Manual, and the checklists. So all of those will be available for download so you can start to develop your own and not have to reinvent the wheel. And then we're going to help you create an action plan. That is where you can go from here today. How do you get started? The steps you need to take. You're going to create your checklist of who your target list of employers. You're going to begin the conversation. You're going to get them involved, get them engaged with your program. You're going to develop a handbook. You're going to align standards, and you're going to prepare students for their work experiences. You're going to identify policies within your employers that might need to be adjusted, set up communication between the employer and the educators, and then plan for site monitoring and ongoing communication. And all of that can be tracked and mapped in the resource you can download today, which is available to you so you can start your action plan, create your list, get everything in writing, and get started with planning to getting the extra in your externships. We're very excited that you all were here today. I know we are at the end of time. We are going to go ahead and take a few questions. We understand if you have to drop off because we're right at the end of the hour. I know Sarah's been writing down questions from the chat, so I'm going to ask her to share the first one.
Yes, so just so you know, we have had a lot of questions come in about what will be sent out after. You can expect that by end of day on Friday or early Monday, so we will be sending all these resources out to you guys, so expect those to help you all out within your classroom. But we are going to get into a few questions here. Again, we do realize that we're a few minutes over, so please stay on if you can. If not, we definitely understand, and you can reach out to us after to make sure we get your questions answered. So this one is for Stacy, and she answered it, but we wanted to make sure that everyone on the line can hear it. The question is from Janice. It's, how do you pay for meetings, and do you offer refreshments at them? Stacy, that'll be a really quick answer, but just want to make sure everyone on the line can hear that.
Yeah, absolutely. So the answer that I gave is that our partners in our Chamber of Commerce pool funding together to pay for those meetings. And we also draw upon our other partners in other areas to host. So as far as space goes and that type of thing, we don't pay for anything.
Awesome. Sounds good. And then the next question is, HIPAA is a barrier when trying to place students. How do you approach this with potential partners? And that is from Susan Kelly.
Do you want me to take this one?
I think that would be great.
Oh, sure. So a lot of what we have done anyway is to just have a conversation about what their concerns are. We also do a HIPAA training with our students. If the employer has a required HIPAA training that they prefer students to undergo, we do our best to make arrangements so that students can receive that training, or that the employer has seen what we do offer in our class already and signed off on it as acceptable. We also do, like I said, even a lot of training with our students, especially if they're going to be doing placements in their own communities, so that they understand just those even nuances of working with people that they do know. But we kind of approach that on the front end and are pretty transparent about, we know this is going to be a concern of yours, so let's talk about it right away, rather it being something that comes up later. So I would encourage you to do that, of just address it just head on and say, here's what we do, what do you all do, how can we make sure that we're satisfying what needs to be accomplished with HIPAA.
That's great. I don't think we have any other questions in the chat right now. Is there anyone else that has questions? I'll just give it a minute.
We have one more question here. I believe this is for you, Stacy. It's, do you ever feel understaffed to do all of this?
Oh, yes, of course, of course. We are definitely understaffed. I think every school district is and would probably say the same thing. That said, I do, and I'll tell you what our secret is here in Metro, and it is the best secret in the universe, and I'm just going to ruin it and tell you all, is that I employ teacher leaders to help with this work. And so I use some of the Perkins funding to pay stipends to my head health science teacher, as well as another teacher who works directly with a couple of particular partners to shape a lot of this, to oversee some of the experiential learning pieces, to be present at meetings that I can't be at. I pay for the sub out of our local dollars, so I have a little pool of money I can spend discretionally. And I use their help, and I want to encourage you to look to your teachers to see, is there anybody there that would be willing to step up if you paid them a stipend. Another thing that we've done is to employ past teachers who have retired or who have went back to industry, and so we utilize those folks on kind of a contract basis as needed to come in and support with a particular piece of work, or to come in and do some analysis or training or something for us. So again, encourage you to look at people who've left you or who've returned to the field, but who already have those educator credentials, who've worked with students before and kind of know what that's like. But really the big secret that I have is just utilizing those current teachers and paying them to be your support people. So think about that as a solution.
And we hear that a lot. And just so you know, when we talk with smaller programs and schools, a lot of times it is the health science teacher who is putting the advisory board together. So, this is a large scale, large scope operation, but no, all of these same principles can be boiled down to align to an individual school. And get started in a small way, and it potentially could grow as your programs and the schools around you grow as well. With that being said, I'm just going to wrap up. I know we're after time. I really want to thank all of you for dialing in today. It's been a fabulous experience listening to all the questions and the engagement out there, so thank you for that. As a reminder, the recording for the webinar, the slides, and all of the resources we shared in the tools today will be shared with everybody who's dialed in and anyone who wasn't able to dial in. We know teachers' calendars are not always their own, so it will go out to all of them as well. And so we're really thankful that you shared time with us today, and look forward to hearing all of your success stories. Thank you so much, everybody.
Thank you all.